There is a lot of misnomer attached with this term. Whenever we say diastema, people think that we are talking about the gap between the sentinel incisors. Actually, it is not. This diastema is actually the gap between the teeth, and this gap with the definition of the diastema can be present in between any of the teeth. This gap can be between lower 6 and 7. Still we will call it as a diastema. With this particular condition, when we talk about the upper sentinel incisors, this is called midline diastema. So there is a difference between the term diastema and midline diastema. In the European literature, they use the word median instead of midline. So the both terms are used, midline diastema or a median diastema. When we talk about the maxilla, the proper term would be median or midline maxillary diastema. So if we talk about the gap between the sentinel incisors of the lower sentinel incisors, then we will use the median or midline mandibular diastema when we talk about the mandibular teeth. So let's discuss this case in detail. So for the proper diagnosis and treatment plan, we need to have the full proper history of any case, proper clinical examination, radiological examination, then we actually need and land on the proper diagnosis. So talking about this case, this will be called as a median or midline maxillary diastema. So the point is that how exactly we'll be approaching toward this condition. First come first, we should be aware of the features of the primary dentition. And mixed dentition. This is very important for a general dental practitioner to have the understanding of the features of the primary and the mixed dentition. In the primary dentition, we know we have the gap between the sentinel incisors, between the deciduous sentinel incisors. This is called the primary spaces. That is the gap between the deciduous teeth, and the gap between the sentinel incisors of upper sentinel incisors in the maxilla, in the mixed dentition, especially in the age of 8 to 9 years. This is very common to see, and this is the features of the mixed dentition. What happened actually when the canine teeth erupt? When the canine erupt, this is erupting actually in a mesial direction. So this start pushing the root of the lateral incisors like this, and this lateral incisor have a push on the sentinel incisors. This is 1, this is 2, this is 3. So what actually happens when the 3 is erupting medially? This push or start pushing pressure on the root of the lateral incisors, and this has in turn pressure on the root of the sentinel incisors, and as a result you develop a gap between the sentinel incisors. This stage is called ugly duckling stage. This is a normal feature of the mixed dentition, and any clinician should be trained enough and wise enough to diagnose the case of ugly duckling stage. Because of the typical feature, the canine would be unerupted, or maybe the lateral incisor may be unerupted, and you would have a distally angulated sentinel incisors. And this can be confirmed radiologically when you take the periapical X-ray of this condition or the occlusal radiograph. You will see the canine root is in touch with the lateral incisors, and you see the conversion or mesially inclined root of the sentinel incisors. So that is the one reason of the diastema, and this is pretty much normal. However, there are certain conditions, but this range of this gap is around 2 millimeter. This is if the gap is up to 2 millimeter, you do not have to do anything, and this will be closed simultaneously. What happened? Why it need attention? If the gap is more than 3 millimeter, then you need to investigate the cause in full depth and detail, because the hypodontia or the missing lateral incisors is up to 2% of the population. So at this stage, 8 to 9 years, you could be able to identify which cases actually has the missing lateral incisors. So how you can diagnose is the gap between the central incisors more than 3 millimeter is an alarming sign, and you need to diagnose in depth and detail what actually is causing this gap. There could be many other reasons like the midline pathologies or midline resistance. So what I mean to say, that ugly duckling stage having 2 millimeter gap is pretty normal, and up to 2 millimeter gap closes spontaneously. But if the gap is more than 3 millimeter, it need to be fully investigated radiologically, and it should be treated by closing this root. So far we have discussed the causes of the diastema, like MMD stand for median maxillary diastema. What we have discussed as the feature of the primary dentition. Secondly, we discussed about the ugly duckling stage. Then this gap between the central incisors can be caused by any hindrance or obstruction. This particular obstruction can be a soft tissue obstruction, or it can be a hard tissue obstruction. Talking about the soft tissue obstruction, this particular obstruction can be frenum in the soft tissue obstruction, and most commonly, if a supernumerary tooth is present, by the location of this supernumerary tooth, this would be called as a mesiodens. Okay, and there could be any pathology. Pathology means there could be any tumor or cyst in between the central incisors. Moving on to the other causes, then this central incisors can be at fault as well, and there could be any possibility of the periodontal problem, and due to the periodontal problem, you would see the flaring of the upper incisors. And when you will see the flaring of the upper incisors, you would see the gap will start appearing in between the central incisors. So this condition is called pathological tooth migration. What is pathological tooth migration? You develop the periodontal problem, and as a result of the periodontal problem, the upper incisors start flaring, or you could have the flaring of the lower incisors, which may cause the hitting of the upper incisors. That's called the trauma pharmacology, and that start the flaring of the incisors. That could be one reason for the diastema. Another reason could be the crown root angulation. If the crown root angulation, that's this is a rare condition. If there is a divergence or abnormal inclination or angulation of the root and the crown, just like this is the root and this is the crown, and if the crown is abnormally angulated with reference to the root, then this may cause and create a gap between the central incisors. However, there is some bracket positioning error as well, in which you could have the divergence of the crown of the central incisors because of the faulty position. For example, if the crown is at the normal position, but you have faulty position the wire. So when the wire will be passing like this will start rotating the crown in this direction, that this part will start moving distally, and this start creating gap. So that could be bracket positioning error, can be the reason for the diastema. And diastema we call as the gap between the tooth that is more than 0.5 millimeter. If the gap between the central incisor and tooth is more than 0.5 millimeter, we call it as the diastema. So far we have discussed the etiology. The first for the mnemonics we discussed from medial side to the distal side. Talking from the medial side, we have the soft tissue like the frenum, we have the mesiodens, and we have the tumours, cysts, or any pathology. Coming to the central incisors, we could have the abnormal angulation of the crown and root, we could have the pathological tooth migration, and we could have the faulty bracket positioning of the central incisor that could cause divergence of the root of the central incisor. Moving on to the lateral incisor. The lateral incisor can also be the etiological factor of the diastema. For example, if you have a peg lateral or you have congenitally missing tooth. So in case of the peg lateral, the central incisors will not move easily and this gap will not be closed. So because of the hypodontia of the lateral incisors, hypodontia called congenital missing tooth, the central incisors would be distally moved and you would see the gap or the diastema between the central incisors. Or if you have the morphologically short crown of the lateral incisors, that condition typically causes the back lateral phase, that also cause the creation of the gap between the central incisors. Moving on to the other causes. Let's talk about the habits. When we talk about the habits can cause the gap and the flaring of the central incisor as well. Just we have studied the thumb sucking habit. Starting from the thumb sucking, if the thumb sucking habit is more than 6 millimeter, so habits, if the child is placing thumb or any finger behind the central incisors, so that typically create the flaring of the upper incisors. When the upper incisors flare, you would develop the gap between the central incisors. So that condition also create the diastema. Along with the thumb sucking habit, the other habits also create the gap between the central incisors. Thumb sucking, mouth breathing, because in the mouth breathing, the mouth will be open. When the mouth will be open, the upper lip will not be resting upon the upper central incisors, and there will be a disbalance between the labial and the lingual forces, and the upper incisors will be allowed to flare. Thumb sucking, mouth breathing, tongue thrusting. Tongue thrusting, very important we all know that if any habit is more than 6 hours, then it will cause its pronounced effect. When we talk about the tongue thrusting, it means that the position of the tongue is causing the flaring of the upper incisors. Similarly, having the logic of this, macroglossia. In the macroglossia, the resting position of the tongue, because of its enlarged size, is the culprit, and you would have this problem in this tooth. Moving on to the other causes. The other causes can be memorized like this. We talk about the habits. We talk about the racial predisposition. Racial predispositions mean that certain races are more chances of having this gap, and for example the Negroes. There are certain races which are having more problem. Then we could have some hereditary factor. Hereditary factor mean that if this problem runs within the families, so all of the cousins and all of the family would having this diastema. This U stand for ugly duckling stage that we discuss in detail. This diastema can also be caused by the rapid palatal expansion. This is a transient phase during the rapid palatal expansion when the both sides of the maxilla expand. one of the central incisors attached with one side, the other central incisor attached with the other side. So when they expand, there is a transient development of the gap between the central incisors. This particular gap is transient, and after some time, this gap actually closes. Another cause of the diastema can be the dentoalveolar trauma. Dentoalveolar trauma. That can cause, for example, if there is a hit on the central incisors, then it will start the malpositioning of the one tooth, and you may develop a gap between these teeth. These all 15, 16 etiological factor can be memorized with some mnemonics. There is a statement, my friend Tahir plays cricket but prefer hockey more. My friend Tahir plays cricket but prefer hockey more. So this is your one central incisors, this is your other central incisors. We are memorizing the etiology of the maxillary midline diastema, starting from the midline, moving toward the central and then lateral. M start for mesiodens. Obviously, it will be found in the middle of the tooth. F stand for frenum. T stand for tumour. What I mean to say that in the mid of the two central incisors, there could be frenum, there could be a supernumerary tooth like mesiodens, there could be any pathology like tumor or cyst. So mnemonics is MFT, my friend Tahir. M stand for mesiodens, F stand for the frenum, T stand for tumor. Place, P stand for pathological. Now we coming to the central incisor. In the central incisors, you could have pathological tooth migration. So P stand for pathological tooth migration. Plays cricket. Then we talk about the crown to root angulation. Then stand for bracket positioning. We discussed in the last clip. My friend Tahir plays cricket but. So far we have discussed any mesiodens, M stand for mesiodens in between the central incisors, any frenum between the central incisors, any tumor between the central incisors, tumor study pathology. P stand for pathological tooth migration of the central incisors, flaring of the central incisors caused crown to root angulation problems. B stand for bracket positioning error, can cause diastema but prefer. P stand for paglateral. Now if you see, we discussed all the etiology of the midline, then we come on the central incisors, then we are coming on the lateral incisor. So the paglateral is etiological factor because of its diminished size, the central incisor move into this place and can cause diastema. So P stand for paglateral. The H stand for hypodontia. If the lateral incisor is congenitally missing, obviously the central incisor move into this place and you would have a gap between the central incisors. So H stand for hypodontia and M stand for microdontia. If there is a generalized small size of the arch, then you would have the gap between the central incisors. So my friend Tahir plays cricket but prefer hockey more. M stand for mesiodens, F stand for frenum, T stand for tumor, P stand for pathological tooth migration, C stand for crown to root angulation problem, B stand for bracket positioning error, P stand for peg lateral. Now we coming to the lateral incisors. H stand for hypodontia of the lateral incisors, and M stand for microdontia of the dentition. So there is 1, 2, 3, 4, 5, 6, 7, 8, 9 causes of the midline diastema. Then after these 9 causes, you have to memorize the mnemonics HR hurt. There are many departments in an organization, and which department is more lethal, which detect the salaries? HR department. So HR hurt, HR department hurt. So H stand for, let me create spaces. Now we have lost the rhythm. We started the rhythm from the in between the central incisors, then we come to the central incisor, then we come to the lateral incisors. Now we are out of the rhythm and we are away from this. H stand for the habits, and the habits can be thumb sucking, mouth breathing, tongue thrusting, tongue thrusting, or macroglossia. Macroglossia is actually not the habit, but increased size of the tongue. I have combined it the symbol way because of the similar mode of action. Then this R stand for rapid parietal expansion. Then the rapid parietal expansion, you develop the transient diastema that must not be treated. Okay. Then this H stand for hereditary predisposition. U stand for ugly duckling stage. R stand for racial predisposition. Racial predisposition means certain Negroes would have more problem, and T stand for trauma. So the mnemonics would be: my friend Tahir plays cricket but prefer hockey more. Mesiodens, frenum, tumor, pathological tooth migration, crown to root ratio, bracket positioning error, peg lateral, hypodontia, microdontia, habits, rapid parietal expansion, hereditary causes, ugly duckling stage, racial predisposition, and dentoalveolar trauma. And